Are you taking prednisone for lichen planus and wondering if there are any natural substitutes or alternatives to prednisone you could possibly take? I can understand why, because prednisone causes more side effects than any other drug. Hi, I'm Dr. Megan, your prednisone pharmacist, and I looked up lichen planus in the Natural Medicines database. It's a database with great scientific evidence, and they rank it from not effective to insufficient evidence to effective of natural substitutes that you might use. And so I wanted to share some of those with you so that you can know what you could possibly use instead of prednisone. And at the end, I'll share what you can possibly do if you have no other choice but to continue taking prednisone. So I'm going to go from the good news all the way down to the bad news. So first of all, there are two possibly effective natural substitutes for prednisone. The first one is aloe. So rinsing the mouth with aloe-containing mouthwash or applying aloe gel to the mouth or the vulva may reduce pain and improve lesion healing time in patients with lichen planus. Second is a thunder god vine. Now, this is a traditional Chinese medicine vine that grows in China, but it's kind of hard to find. You'll want the 20-to-1 extract, and it seems to improve the symptoms and recurrence of lichen planus. But if you can find it, is the key. Now I want to share some potential natural substitutes, remedies, or alternatives to prednisone that just don't have a lot of great evidence yet. They might have emerging evidence, but as of right now, there's just not enough quality evidence. So I'm going to just read you the list so you can know exactly what may or may not actually be helpful. First, black seed. Next, blue-green algae. Bovine colostrum is next, and then coconut. Coenzyme Q10 is insufficient reliable evidence to rate, as is echinacea, hyaluronic acid, hypnotherapy, licorice, light therapy, progesterone, Roman chamomile, selenium, and turmeric. They might help, they might not. There's just not a lot of great evidence. So that was the good news and the bad news. A little more good news. If you have tried everything and nothing is working and you have to take this medication that we love to hate because it's the most hated drug in the world, then I have a solution for you. When I personally had to take prednisone for my autoimmune condition, I was suffering and I wondered, is there anything else we could possibly do? And then one day after 8 months of treatment on prednisone, I realized, I had this epiphany, this light bulb moment. I realized that prednisone is causing side effects because it's stealing nutrients from our body. So if we give those back, then we won't feel so awful. We'll minimize the side effects and the risks associated with taking prednisone. So what I did is I compiled all of the evidence of what prednisone is stealing, plus I found some ingredients that help counteract side effects directly. And I put them all into one easy-to-use supplement that you can take along with prednisone. So what you do is you take prednisone, your normal dose of prednisone for the day, along with the morning bottle, just 2 capsules in the morning, and then 2 capsules at bedtime to help you sleep restfully at night. You can just go to nutrinice.com to get the support you need while taking prednisone today. Signing off as Dr. Megan, your prednisone pharmacist.